Good afternoon, everyone. It's almost noon. I'm going to give it just a couple minutes as people join, and then we'll get started. We still have people joining, so I'm going to give it just another minute till we see the numbers start to slow on the people joining, and then we'll go ahead and get started. Okay, looks like we're holding steady with the number of attendees now, so we'll go ahead and get started. I am Holly Wimsatt, the Director of the Bureau of Disability Services. What you see on your screen is our core value here at BEADS and within the Division of Disability and Rehabilitative Services, and that is that all people are empowered to live, love, work, learn, play, and pursue their dreams. So today, if we can go to the next slide, please. This is the BEADS Provider and Case Manager webinar. We do this monthly. We welcome you, and we are glad that you are sharing some time with us today, particularly over the lunch hour. We appreciate it. Before we get started, we'll walk through a couple housekeeping items. There is no need if you are a provider or case manager. Of course, you're a provider or case manager. There is no need for you to sign in. If you want to or need to use live captions, you have the ability to turn on live captions and subtitles. To do so, select Captions, Subtitles On in your video controls, and then change the caption language, or to change the caption language, select Settings, Caption Subtitles, and choose the language that you want. Now, if you have questions during today, you are welcome to put those in the Q&A that is located on the right side of your screen. Just simply type in your question in the compose box and then select Send. Your questions will only be visible to the presenters. So that would be myself and some other BEADS team members, Heather Dane, our Chief Program Officer, and Richard Probst, our Director of Provider Services. We will be able to see those, but they will not be visible to other participants or attendees. And then if we have time, we will answer some of your questions as we are able. As a reminder, we are including questions from previous webinars in each monthly event in an effort to get those questions answered and back out to those of you that are in attendance. And we will post these as well. The slide deck and the recording will be posted after today's so that that's accessible in case you have colleagues who were unable to attend. All right. So our agenda for today includes updates for all providers, some updates specifically for health and wellness and traumatic brain injury waiver providers, some updates for waiver providers of the community integration and habilitation and family supports waivers. And when we say providers, we're including case managers in that. And then November webinar questions, we'll go through some of those. We'll talk about if you have do our typical request for webinar topics for future webinars. I do want to note that as we get further past the waiver transition, where the health and wellness and traumatic brain injury waiver came under BEAD's operations, we continue to our efforts to align across all of our services within DDRS and BEADS in the terms of our waivers, and are looking to expand those connections with broader updates. So just know that as time passes, you will see more updates for all providers as we continue our efforts in that alignment process, and fewer designated specifically for providers on certain waivers. So just know that we're all one big service system, and we are working towards more alignment whenever possible. Okay, so some provider updates for all providers. And this is all providers regarding home and community-based services. So way back in 2014, our partners at the Centers for Medicare and Medicaid Services, or CMS, issued the Home and Community-Based Services Settings Rule. This is nothing new at all, but just want to talk about it because it is a guiding rule for HCBS or waiver services. In this settings rule, CMS clarified expectations about person-centered planning and the things that need to happen with HCBS waivers that we're administering. That includes where and how supports are provided. So home and community-based or waiver services are provided in settings. The settings rule requires this, that waiver services be provided in settings that are integrated in and support full access of individuals receiving Medicaid HCBS to the greater community. That includes opportunities to seek employment and work in competitive integrated settings. That includes opportunities to engage in community life, control personal resources, and receive services in the community. And this is really the key piece, to the same degree of access as individuals not receiving Medicaid home and community-based services. So as part of the settings rule, states define what a provider-owned or controlled setting, or because we love acronyms, what a POCOS is. So in 2023, BEADS updated the definition of provider-owned or controlled settings based on feedback that we received from our partners at CMS during their on-site visits to some home and community-based waiver settings. So this settings rule applies to all HCBS, and the POCOS definition, the provider-owned or controlled setting, is defining what BEADS considers a provider-owned or controlled setting. And it's important to note, particularly for the CIH and FS waivers, that it's not limited to residential HAB or RH2O, but would be applied to any residential setting where a waiver recipient or participant is receiving any waiver service where they are not living with family. It's also important to remember that CMS guidance is clear that a home and community-based services setting should not have the effect of isolating individuals from the broader community of individuals not receiving HCBS. Thus, it is incumbent upon the state and our provider partners to ensure that individuals have access to and are integrated in the broader community, and that they receive services in the community to the same degree of access, again, as individuals not receiving home and community-based services. So a setting meets the definition, or a setting that meets the definition of a provider-owned or controlled setting requires additional monitoring. So it's okay to have provider-owned or controlled settings. I want to be clear about that. But they do require additional monitoring. And that additional monitoring is just to ensure compliance with that home and community-based services settings rule. So for the family support and the CIH waivers, the additional monitoring takes place via questions completed by the case manager to ensure that the individual residing in the provider-owned or controlled setting has the same level of service or level of choice and protections as the individual living in a setting that is not a provider-owned or controlled setting. For the health and wellness and TBI waivers, case managers complete and document the person-centered monitoring tool every 90 days for participants residing in a provider-owned or controlled setting. So that is one way that we utilize the provider-owned or one way that we monitor or provide the additional monitoring of the provider-owned or controlled settings across the different waivers. The other thing we want to stress is a setting being identified as a provider-owned or controlled setting does not equate to heightened scrutiny. So home and community-based settings could be flagged as a heightened scrutiny setting, regardless of whether they're considered a provider-owned or controlled setting. But there is a difference. The heightened scrutiny process applies to home and community-based settings that are presumed to have the qualities of an institution. And CMS describes 3 specific categories of residential or non-residential settings that are presumed to have the qualities of an institution. 1, settings that are located in a building that is also a publicly or privately owned facility that provides inpatient institutional treatment. 2, settings that are in a building located on the grounds of or immediately adjacent to a public institution. And 3, any other settings that have the effect of isolating individuals receiving home and community-based services from the broader community of individuals not receiving home and community-based services. All right. Next slide. I'm going to talk a little bit or provide some reminders about home modifications. So if you are a case manager and you're working with an individual on a home modification and that process, right, of once a family has identified that they would like to explore a home modification or environmental modification, all bids need to be itemized and they need to provide details of what the provider is responsible for completing and with what materials, equipment are being used. Case managers need to go over the winning bids with individuals and their families, if applicable, of course, and those bids should be signed prior to the modification taking place. We have a note here that home and community-based services waiver funding cannot cover structural issues or upgrades from basic modifications. So what we're really looking at with home modifications is making the home accessible for the individual. That would not, again, include structural issues or upgrades from what would be considered a basic modification. Next slide. Okay, little reminder for case managers. So A&E, that's abuse, neglect, and exploitation fact sheets. So as a reminder, all waiver case managers are responsible for sharing the abuse, neglect, exploitation fact sheet and the companion acknowledgement form annually. Can't stress that enough. You need to ensure that people understand what A&E is and how to report it. Once the A&E fact sheet is discussed with the individual and the signatures received, that should be uploaded with the discussion, and the discussion should be case noted in the BEADS portal or in CAMS, depending on what system you work in. I do want to take this opportunity to just emphasize that we at BEADS are reliant on case managers to document their activities in the BEADS portal or CAMS in order for us to have an understanding of what's happening or not happening with regard to individuals and their services. So, as you navigate your work as case managers, that documentation of your activities is key to helping us understand if we have a question or receive an inquiry. We are dependent on the notes that you enter into those IT systems, those case management IT systems, to know what's happening. And if there isn't sufficient documentation, you'll likely get a reach out from us. So please make sure that you're documenting your activities so that there is some visibility there, and that if you need support in working with a family, or if a family reaches out to us with a concern, we can see what's happening at any given time on any given case. Slide. All right, now we'll do some provider updates for the health and wellness and TBI waivers. The first one we're very excited about, effective July 1st of next year. CAMS will no longer be utilized by case managers supporting individuals on the health and wellness and the traumatic brain injury waivers. We will be utilizing the BEADS portal in July. So we are very excited about that. We understand some of the challenges with working in multiple systems. We know that some case managers already who support individuals on health and wellness or TBI and the FSW or CIH are working in two systems. And we are excited to be able to consolidate the functionality in CAMS for the health and wellness and TBI waivers into the BEADS portal by July 1st. We will be providing training and support to case managers, of course, prior to the July implementation. So stay tuned for that. And just know that we're excited about this, and we hope that you are too. For those who are have not worked with BEADS for very long, I will share that the BEADS portal does a lot of different things for case managers and even providers. So know that for July 1st, our goal is again to move the health and wellness and TBI waivers and that functionality into the BEADS portal. But that is not the end of our work with the BEADS portal. As with any IT system, we get lots of bites at the apple and it takes lots of bites at the apple to get the system where we need it to be. But getting that basic functionality in the system is set for July 1. So I already see a question about when the training will be provided. Know that that's coming. It will come closer to July 1. However, because what we know is training on IT systems. The closer you can get that to the actual go live date, the better it is for the users. So just know that you will receive training and outreach and support as we transition to this. But we are very excited about it. I will note too that it was just in 2022, I believe, in November of 2022, that in BEADS we moved all the case management functions from Insight to the BEADS portal for the family support waiver and the CIH waiver. So, and we've come a long way since November of 2022. So we are very, very excited to move forward with that, and we hope you are too. We know that will bring up some questions, so feel free to put the questions in the Q&A, and you can also send questions to BEADS Help. I know the IT system that case managers use is key to their work, so please, feel free to send us questions at any point. Next slide. Okay. Also wanted to talk about the service plan reviews on the health and wellness and the TBI waiver. So just a reminder that when a PCSP is under review and it's necessary to pursue Medicaid PA, individuals and families should be supported in seeking an assessment for skilled home health with a provider of choice, rather than a blanket outreach to 3 providers at once. So this is what we are hearing, is that there are at least some instances of individuals and families being told, you need to call 3 home health agencies and see if they can provide services. Or you need to contact 3 home health agencies and get denials from them in order for us to pursue your service plan. So I want to regroup and make sure that we are all aligned in that the goal of seeking services through Medicaid PA is to ensure that individuals have access to the appropriate resources and services. If there is a service out there that an individual would benefit from, we want to connect them with that. So it isn't about getting 3 denials. It's about, let's see what other resources you may be eligible for and have access to. So we are asking case managers to support individuals and families through that process, and helping them in any way we can to make sure that they're connected with available resources that might provide some additional supports. Next slide. All right. So the level of care assessment representative, I want to provide an update on that and just make sure that we're all aware that effective July 1st of next year, there will be one entity that completes all nursing facility level of care assessments for those seeking nursing facility placement or home and community-based services via the health and wellness, traumatic brain injury, or pathways waivers. The nursing facility level of care assessment tool for adults is not changing. Nursing facility level of care will continue to be assessed utilizing the Entri home care tool that is used today. On July 1st of 2025, and we have had communications about this, we will see implementation of new tools through the Entri suite of tools to appropriately assess nursing facility level of care for children. This includes some additional tools from that Entri suite, the Entri Peds Home Care, and then the Entri Early Years tool. So training will be forthcoming on those as well. Um, uh, but those will be completed by the LCAR vendor effective July 1st of 2025. Right. I see that we have next our provider updates for the CIH and FSW waivers. So going to start with something we've talked about before, and that is the provider attestation. A provider system administrator must log into the BDS portal and confirm the provider profile information at a minimum of every 90 days. We are near the end of the final quarter of 2024, and well over half of all CIH and FSW providers have yet to complete a provider attestation. So this is a CMS metric that we report on, and we need providers to complete these attestations. They do not take long. I want to be very clear about that. If there's no changes, it does not take a long time to do that. The provider profile information should always be updated anytime there is a change in the provider profile. If you are a provider on the CIH or FSW and you need assistance with completing the provider attestation, we have resources in the BDS portal user guide for providers. That's in the resource section under the user guides tab. We are exploring some opportunities to ensure that individuals and families who receive the choice list for the FSW and CIH waivers, for them to be able to know when providers last updated their profile or attested that it was current. And that is because we have heard from individuals and families that our choice list isn't always reflective of providers' current information. So we will be exploring options to improve the quality of the choice list for the FSW and CIH and ensure that it's accurately reflecting providers' most current information. Next slide. Provider referrals. So please, if you are a provider on the CIH or FSW, check your provider referrals grid and respond to those referrals within 30 days. You may view the referral and accept, reject, or request additional information by selecting the record. This was an ad also that was incorporated into the BDS portal that we did not have previously. And it is designed to really provide some transparency on referrals and where those referrals are going and what those responses are, and even why referrals may be rejected or accepted. So this is really great information as I can provide really great information as we look at our overall system. So we again ask providers to be sure to regularly check those grids and respond to those referrals. If you're a provider on the CIH and FSW and you have questions or need support with the provider referrals, again, in the BDS portal user guide for providers section, we have information on provider referrals under the user guides tab. If you look through that and you still have questions, please know you can reach out to BDS Help. We are happy to support you in your processing of referrals. Okay, short-term and long-term budget requests. So I want to just emphasize that both case managers and providers are responsible for proactively monitoring the BEADS portal for new ST and LTBRs, as well as for requests for information. The portal works on those, utilizes grids for that. So we do have to check our grids in order to know what work is waiting for us, right? And that applies to case managers, providers, and BEADS alike. RFIs for STBRs and LTBRs really shouldn't be necessary if all information is provided in the original submission. We ask that the case manager or case manager supervisor ensure that all information is accurate, relevant, and supported by the documentation prior to the submission of the short-term or long-term budget requests to BEADS. So RFIs, are sometimes needed, right? But ensuring as a case manager and provider that you have included all the information will reduce or eliminate RFIs. We know RFIs add time to the processing of STBRs and LTBRs, and frankly, service plans as well for the health and wellness and TBI. So we are just asking, please do your very best to make sure all the information is included. We don't like doing out RFIs. You all don't like getting them. So, the more information you can provide to give us a clear picture on that original submission, the better. If a case management provider receives an RFI, it must be responded to with the requested information or clarification by the deadline provided in the RFI. And right now, for STBRs and LTBRs, BEADS is not RFIing more than twice for the same request. Both case managers and providers can view all statuses of the ST-LTBR process in the BEADS portal. That includes approvals and denials. So, the BEADS portal provides a significant level of transparency when it comes to STBRs and LTBRs. So please use that transparency, check those grids, and, so that you know where things are and communicate, right? If you're a provider and you see that a STBR or LTBR is with a case manager and it hasn't moved in a while since you sent it, reach out to that case manager. Vice versa, case managers, if you've requested more information from a provider, reach out to them and get that information to get that ST and LTBR completed, or the RFI completed, and get it sent back. At the end of the day, again, none of us like RFIs, and we're all here for the same reason, right? To support individuals and families. So anything we can do communication-wise, we want to do because we're all better when we communicate openly and support each other as we work to support individuals. Next slide, please. All right. So speaking of working together, wanted to talk a little bit about resolution of disputes. And this is, again, we're in that section where we're talking about the FSW and the CIH. But if a dispute arises between or among providers, there is a dispute resolution process that should be implemented per 460 IAC 6. This process is designed to address an individual's needs, and the parties shall attempt to resolve the dispute by following the steps outlined. So we wanted to share a situation. This process was recently utilized by a team where there were some disputes between the residential HAB provider and the behavior clinician. The individualized support team was able to meet to resolve the issues, which resulted in the individual being at the center of the supports they receive. BEADS team members or the waiver ombudsman can assist if necessary after attempts have been made as outlined in 460 IAC. Oh, I see a typo, IAC 6. Apologize for the typo. Didn't catch that before. So there is, again, this dispute resolution process. BEADS and the waiver ombudsman are available if needed. But what we've seen and what we're pointing out here is an example where a team followed that process and really didn't need BEADS or the waiver ombudsman. The team was able to work it out. And that team was able to do that because they kept the person as the focus of their efforts. And they were able to talk through the dispute and reach a resolution. So we just feel like that is a great example of how teams often work, but how teams, we want to support teams in working in that way moving forward. I want to talk a little bit about documentation of criminal histories as well. A provider shall obtain a limited criminal history from the Indiana Central Repository and complete a county check for each county where the potential staff resided during the 3 years before the criminal history check. If a provider cannot obtain a county check because the county doesn't provide it, then mycase.in.gov should be utilized. If a background check comes back with a recommendation of fingerprinting or had inconclusive results, those should be cross-referenced with the county, mycase.in.gov, fingerprinting, etc. If a provider is made aware of a conviction, it is required that appropriate action is taken. So before we move off this slide, we have had the Office of Inspector General has been in Indiana doing a health and safety audit of the CIH waiver. And one of the things that they shared with us when they were here is that they were not seeing consistent documentation that this process has been followed. So just know this is a requirement for providers that they complete and document these criminal histories or the criminal history checks. So we wanted to include it here as a strong reminder that those need to be done and they need to be documented. And that documentation needs to be available. Next slide. Okay. We have webinar questions from November that we will talk through next. The first question, can you share the email address for health and wellness and TBI waiver providers to update their choice list record? So we have that answered here. I am going to go through it though. If a health and wellness or TBI waiver provider needs to add or remove services and or counties, or change, add, remove addresses, phone numbers, or complete a change of ownership or other significant change, this is completed through the OMPP waiver certification portal. Once this is updated with OMPP and Medicaid, BEADS will receive the information and update CAMS, which will then automatically update the choice list. You do not need to contact BEADS, as BEADS receives this information directly from OPP. Now, if there is a simple change for a health and wellness or TBI waiver provider, and that simple change being just a change in the contact person, this can be emailed to BEADS Provider Services at fssa.in.gov and will be completed as soon as possible. Question 2, what is the expectation for AAAs or health and wellness TBI case managers to update waiver providers when there's a case manager change? So We've referenced here the HCBS provider module if you want to take a look at that under case management. But case managers on the health and wellness and TBI waivers are responsible for directing collaboration and coordination with providers and monitoring progress from identifying need to meeting goals and or preferences identified by the participant. Additionally, case managers are expected to engage the participant and their circle of support in all aspects of the case management process, as well as coordinating and collaborating with other entities. Thus, it is expected that case management providers ensure that providers supporting an individual and providers they are supporting are informed of case manager changes. So if you are a case manager on the health and wellness and TBI waiver, it is expected that other waiver providers supporting the individual be notified of the case manager change. Those providers need to know who to reach out to if there is an issue, and they can't do that very effectively if they don't know who the case manager is. So again, it is expected that when there is a case manager change, that information is shared with other providers on the team. Next slide. Question for the CIH and FSW providers within the BDS portal. There are two places a provider can identify not having staff for that county and or not providing certain services in certain counties without actually deactivating the service. Are those enough? It seems we still get referrals when we do these things. It's a good question. So if a provider is currently on a choice list for a service or county, only deactivation will remove them from the choice list and discontinue referrals. So a provider may indicate they are not having current staffing or a desire to temporarily interrupt referrals in their provider profile. So sorry. That will not remove the provider from the choice list. In order to discontinue referrals, a provider must actually deactivate the appropriate service or county. Okay, next question. Can you share more about referral processing? Are individuals still selecting a provider from a pick list? Yes, individuals utilize the choice list. We call it the choice list now. We did some improvements on what we formerly referred to as the pick list. We did some improvements to that choice list that I kind of talked about a little bit earlier about when discussing the provider attestations. But individuals still utilize that choice list that is generated out of the BDS portal to select a provider for a desired service. And then providers, as we talked about the provider referrals a few slides ago, receive and respond to those referrals via the BDS portal. Okay, so we are now at the slide where we ask you, again, what topics you would like to hear more about. We recognize that your time is valuable, and we want to make sure that we are providing information that is useful to you and that supports you in your work. So we ask that you either put in the Q&A some ideas, or you can send us ideas for topics of future provider case management webinars at the BDS Provider Services at fssa.in.gov. We are already looking at scheduling the next year's, or at least the first quarter, provider and case management webinars. So certainly, please let us know questions that you may have and topics that you might like us to cover.
So Holly, we
uh-huh.
have a couple of questions that I think we
Yes.
might have a couple of minutes. And thank you all. Your questions have been coming in, and I have feverishly been trying to answer them as they have been coming in. But we have had several questions around the transition from CAMS into the portal. As you know, we expected. We know everyone's very excited about that and has lots of questions. And so one thing I will just reiterate that as those trainings become available and those dates and those materials, you know, we will let you know as soon as possible. So we want to ensure that we are giving you all and your staff plenty of time to become familiar with the portal and to be ready for that July 1 date. But with that in mind, Holly, there have been a few questions around, will CAMS continue to be utilized for MFP pathway clients or for non-waiver clients?
Yeah, that's a great question. So and I appreciate you're asking that. So as that question infers, there are other things that happen in CAMS and other uses of CAMS other than the health and wellness and TBI waiver. July 1st is for the health and wellness and TBI waiver and MFP. That July 1st deadline is for the functionality. And I appreciate someone, the person asking the question, bringing up MFP. Those will transition to the BEADS portal July 1st. The non-waiver will not transition on July 1st. That is the Division of Aging after the new year will be kicking off some efforts around the next steps with the non-waiver population, but that will not happen July 1. Those efforts will begin July 1st in engaging with stakeholders about the non-waiver, but that transition to the BEADS portal for non-waiver will not occur on July 1.
Thank you, Holly. I think with that, there's also a number of TBI and health and wellness providers wanting to know if they are going to be transitioning into the portal as well.
So I'm going to rely on Heather to confirm for me, but right now we are looking at moving the case management piece of health and wellness and TBI into the BEADS portal. All the things I talked about with the provider attestations and the provider referrals, we will not be doing that July 1 for providers of the health and wellness and TBI waivers. Now, that is a great question. And as that question also indicates, you can tell, I'm sure, that we have spent quite a bit of time and blood, sweat, and tears in that BEADS portal to move a lot of provider functions into that for the CIH and the FSW, right? And those were around providing more transparency among team members so that there's better communication among team members, the support team members of the individuals. So our plan would be that those providers would function or have that same functionality in the portal as providers of the FSW and CIH, but we are not there yet, and we will not be there July 1. That will come after July 1st. I hope that answered the question.
Yes, it did. It did. So then kind of staying with the portal, there are questions about, will the supervised group living be added to the portal? Are there plans for that?
So there are plans, but they're not fully formulated, and there is not a timeline. We are very interested in looking at how we can, in particular, get that SGL referral process utilized within the BEADS portal. But we are not there yet, and I do not have a timeline for you right now.
So I'm going to move to the topic of LCAR. There were lots of questions around LCAR and who that vendor is and what that really means for case managers and their responsibilities to complete those nursing facility level of care assessments after July 1 when LCAR takes effect, and what type of training that vendor is going to have to properly ensure they are doing those nursing facility level of cares appropriately.
Mm-hmm. Good question. So yes, that level of care, the LCAR vendor, absolutely will be trained on those new pediatric tools that vendor already utilizes, the Enter-I-HC that is used today. The LCAR vendor is currently providing, and has been for a number of years, has been our PASS-R, or our pre-admission screening resident review provider or vendor in Indiana. So they are very familiar and skilled with administering the Enter-I-HC. And yes, they will have the required training for the pediatric tools.
And sorry, just trying to get through some of the additional ones who have come in. So this is a question that I don't know if we can answer it just yet, but I think it's a good one for us to address. It says, will we need to use both the BEADS portal and CAMS for those who need interpreter services? So I'm assuming that they are asking, and please, Jen, if I'm not interpreting your question correctly, if you're asking for those individuals who may need an interpreter service, which isn't necessarily a waiver service. So maybe that wasn't a good one for me to
well,
I
don't think it's not a good one to share. If you can provide a little more clarity on what you're asking, I'm sure it's a very good question. I'm just not understanding. I'm not understanding the question. So if you could put some more information in the chat, that would be great.
Yeah, I'm not sure if there's a CAMS function that you are using as an interpreter function.
Right. Yeah. Can I answer? I see another question that I want to jump to real quick, Heather, if that's all right. I see a question that if we all move to the BEADS portal, what about overloading the system? Is there a backup? And will the previous information for clients transfer to the BEADS portal? So we're not concerned about overloading the system because we already know, right, what we'll be adding to it. We know how many people are supported on the health and wellness and TBI waivers and MFP. We know how many case managers there are, so we can appropriately plan for that. So we don't have any concerns about that. I think, is there a backup? I'm just going to assume that's a question about, do we back up the data? And we absolutely do. The state has very clear guidelines on expectations about that. And then will previous information for clients transfer to the BEADS portal? Yes, we are working through that now, like how much historical information will come into the portal. But yes, it will not be starting anew. It will bring in information from CAMS. Does the BEADS portal work with Vision Link? No, it does not.
So Holly, I think this is probably in reference to level of care screenings, but wondering if there's going to be a separate division set up for pediatrics.
A separate division within?
I think within FSSA, they're just asking if there's, there's the division of aging.
Right.
They're asking, will there be one for pediatrics?
Sure. I'm not aware of any plans like that. BEADS currently supports individuals of all ages through the lifespan. We have, you know, children that are just a few months old that are have applied for our services. We have, last time I looked, I think we had a 2-year-old maybe at one time that was in our services. So we, in BEADS, we support people through the lifespan. So I see another question, will documents that are in CAMS be moved to the portal? Again, we're still working through all that. That's a great question. And we are still working through that. We recognize that case managers are going to need access to information, the historical information to do their work. So we are sifting through what that, you know, what we need to bring over and what we're able to bring over, and how we can make that accessible.
So Holly, to shift just a moment, and I just lost the question, but it was wondering if you could, they had a question around home modifications, where we state HCBS waiver funding cannot cover structural issues or upgrades from basic modifications. Gotcha. And can you expand on what you mean as far as a basic modification?
Sure, and that question disappeared because I think I hit the button. Sorry, Heather. So we're referring to, when we talk about upgrades from a basic modification, really what we're trying to communicate or reinforce is that the waiver pays for what's necessary, the basic, right? And upgrades from what is needed, what has to occur to meet the need, would not be covered on by a waiver. So, and I'm trying to think of an example. So, you know, that's often a, if a family, let's just say, has tile and the, in the bathroom, or no, that's a bad example. Let's use an example of a kitchen. Let's just say we're modifying a kitchen for someone who utilizes a wheelchair. We're going to pay for a basic sink. The waiver is going to pay for a basic sink. It's not going to cover an upgrade from a basic sink. So it will be probably the metal basic sink, not a granite sink, and that's an extreme example, but that's really what we're trying to get at, is the basic modification, or those basic things that are needed to make the home accessible.
Thanks, Holly, for that. So we've got some clarification around the interpreter question. So an interpreter is a non-waiver service, and so they're just trying to get clarification that they will still need to use CAMS to access those non-waiver services, even for those individuals who may be accessing a waiver and a non-waiver service.
Thank you. That now we get it. Okay, or now I get it. So that is a great question. The answer is yes. The case manager will have to use CAMS for the non-waiver and the portal for the waiver. Now, I know that's not ideal. And believe me when I say we feel your pain, because BEAD staff work in the portal and CAMS, and a much older system called DART right now. So the question we had earlier about supervised group living, or SGL, that is a program, of course, that BEADS administers, and all of that information is not in the portal, it is in DART. So we feel your pain on working in more than one system, and please know that our goal is to consolidate systems whenever possible. It just doesn't always happen as quickly as we would like.
So that takes us right at 1 o'clock.
Oh, it does.
So, yep. So I think the rest of it, there are a number of great questions here that I think we can follow up next month. But I think we've hit most of them in one way or another. So thank you so much, Holly, for taking the
No,
time to do that.
thank you all. And I will say these have been great questions because I've tried to look at them too. And I think next month, maybe we'll cover more questions since we got so many great questions this time. I think we covered 4 this month, but maybe we'll cover more in the webinar next month. So we thank you all for joining us. We really appreciate the participation, and we hope everyone has a great holiday.